All right, every Monday we do a deep dive into what your elected officials have been up to, and as always, we are starting in Iowa. This week we're looking at several bills that are nearing the finish line and a few that have made it to Governor Reynolds' desk, one even signed into law. So here to help us break things down is Dana Searles of our sister station WOI in Des Moines. All right, Dana, let's start with a bill that is advancing, hasn't made it to the governor's desk just yet, but has to do with data centers and nuclear centers and tax exemptions. What's going on?
What this bill does is it actually gives sales and tax exemptions for restarting nuclear facilities as well as different data centers that are being built for businesses. So what it would do is these businesses would be exempt from certain sales taxes. However, they would be required to use 5% of those savings. So what they use or what they save from those exemptions, 5% of that would have to go to Iowa's state universities. So any of the state universities across Iowa, and those universities would have to use that to start making different programs that would help with nuclear engineering programs. So right now, I don't believe Iowa colleges have nuclear engineering programs. It's actually something that not many colleges across the state actually have. So this bill would be kind of used to help not only give these nuclear energy facilities that kind of leg up in terms of saving, but also promote those nuclear engineering programs at Iowa's colleges. So people for this say that this would help, bring these businesses to the state, which would result in major economic gains. However, those against this are saying that it could have an environmental harm. But like I said, early stages, I believe it just passed out of a Senate subcommittee. So still would have to go through committee and both of the full chambers before it could head to Governor Reynolds' desk.
Well, speaking of data centers, I want to turn to healthcare now because there's a bill that would expand the use of AI in healthcare. What do we know about this?
Yeah, so the specifics in this bill is the use of AI would only be allowed for certain medical services that do not need human supervision or intervention. That is exactly what the bill says. Now, kind of further to what that is exactly, that kind of is somewhat open for interpretation, but kind of just your general things where you would not need a doctor to physically do some type of work, whatever that may be. So I want to note this bill right now actually doesn't have a lot of support from lobbyists. A lot of the lobbyist declarations listed online, majority are undecided. There's a handful against as well. We do not see a lot of people actually for this bill. However, House subcommittee did advance this bill. So the bill was actually based on model legislation that was from a conservative think tank. And on that conservative think tank's website where this bill was created, when they're talking about the bill, they're saying it's aimed at combating provider shortages and lowering costs. So a lot of Iowa lawmakers are kind of citing those rural healthcare shortages. Just like the last bill we talked about, it still has a long ways to go.
Well, one bill that we have been following has made it all the way to the governor's desk, and she signed it into law. Remind us what this HMO law, bill now turned law, is all about.
Yeah, so it raises the premium taxes on HMOs across the state. So it'll raise their tax rates from 0.925% all the way up to 3.5%, and that'll go through October. So I believe the last day is September 30th of 2026. Basically, the overall goal of this is to get federal matching dollars for Medicaid funding to make up the state's Medicaid deficit. Those against this said that the customers were ultimately going to be feeling the strains, that Iowans were going to be feeling the strains. Because, typically when a company has their taxes raised, the consumer feels that the most. So that's why a lot of people were against this bill. But like I just mentioned, a lot of the Republicans that pushed this through are saying that this is needed to be done. Another thing of note in the bill is it allocates $89 million to cover the state's current year Medicaid budget deficit, which is right at about $90 million right now. So massive deficits to make up. These federal matching funds are expected to bring in $123 million to the state. So a lot of money that would be brought in right there. But I do want to note this bill made it through both the chambers with Republican opposition. In the House, I believe it was 10 Republicans voted against this bill. And in the Senate, 4 Republicans voted against this bill, I believe. So we did still see some Republican opposition, but ultimately having that supermajority was able to get this bill to the governor's desk and have her sign it.
The other bill we've been watching that's made it all the way to the governor's desk hasn't been signed into law just yet. But this one is also about healthcare. This is about medical providers not giving services that might contradict their conscience. What's this one saying?
Yeah, so the bill is exactly kind of how it's described and talked about is basically medical providers would have the ability to refuse giving a service to a patient if it does go against their conscience. And in the bill, their conscience is defined as any religious, moral, or ethical beliefs. So if a patient were to come to a doctor and were to say they want this certain procedure or this certain medication, and if the doctor felt that that was against their religious, ethical, or moral beliefs, they would be able to deny that service and not allow that for them. So those against this bill, when it did make it through both chambers, like you mentioned, it is on Governor Reynolds' desk right now. Still hasn't been signed into law, so we could still have it just sitting there. But when it made it through the chambers, those people against this, they said that this would just be flat out discrimination, and it would result in a loss of services for a lot of Iowans. However, those for this bill say that it's necessary. It protects those medical providers and it protects them from any harmful lawsuits, etc. So it's something that, we saw a lot of controversy on it in both sides, both the House and the Senate, but ultimately did make it through predominantly along party lines, I believe. All it needs is the governor's signature for to have that become a law.
And now that we're in this final day of March, or these last final days of March, this session's going to wrap up very quickly, and we'll keep watching it every single Monday. Dana, thank you so much for being here with us. And for you guys at home, our political coverage for both states is up on our website. Just click on the As Seen on TV tab at the top of the homepage.